Well, good morning, everyone. First of all, let me thank you again for joining us this morning. As always, glad to have Dr. Toomey here with me, and she'll be giving you an update here in just a few minutes. I wanted to start, much like I did last week, with a quick update on our COVID-19 data. As of yesterday's 3 p.m. report, hospitalizations stand at 4,879. That is the lowest figure that we have seen in over 3 weeks. Our test positivity rate has continued its downward trend to 15.2%, which is down from 19% earlier this month. Our 7-day moving average is down to 5,366. That is the lowest point since January the 1st. These numbers, as you can see, indicate a move in the right direction. But as I said last week, this cannot be an all-clear signal for Georgians that are watching today. Our hospitals, as I mentioned last week, cannot bear the weight of an additional surge in COVID-19 patients. And with more deaths being reported each day, I continue to ask Georgians to do the right thing. As we have mentioned many times, the science is very clear. Keeping your distance, wearing a mask, and washing your hands will continue to help slow the spread of the virus. We've identified one of the new variants of COVID-19 here in Georgia, and much like the early days of the pandemic, there are many unanswered questions regarding how deadly and how easily transmissible they may be. We cannot take the improving numbers that we're seeing for granted. On vaccines, we are continuing to make significant and measured progress. From January 11th to January 18th, we reported over 216,000 vaccinations administered. In the week since, we have reported over 250,000 doses, 251,956 as of 6 o'clock yesterday. Given that Georgia is only allocated 120,000 doses per week, this shows that providers continue to catch up their reporting of vaccinations to the state. As of yesterday, CVS and Walgreens have completed their vaccine program in 99.5% of Georgia's skilled nursing facilities, and the state has started to transition the 40,000 doses previously reserved for CVS and Walgreens into the general allotment sent to providers and public health clinics. This will begin to redeploy supply and hopefully increase availability of appointments somewhat to Georgians that are currently in the 1A plus population, which includes healthcare workers, first responders, and our seniors. We have not yet been informed by the Biden administration that we will receive any increase in our allotment above the 120,000 that we're currently getting, and we do not expect that to change, certainly for the next few weeks. That being said, our goal continues to be twofold. One, to utilize our current allotment as quickly and safely as possible. Two, plan for the increased supply whenever that day may come. Dr. Toomey and our entire team continue to explore ways that we can maximize our efforts to quickly put more shots in arms, and I think the data reporting to the state shows we are making headway there. And just as importantly, we are working around the clock to plan for the next phase of the vaccine distribution. This includes further expanding the categories of professionals who can administer the vaccine through executive orders to include dentists, pharmacists, and EMTs, while we also recently reduced the requirements on licensed practical nurses, medical assistants, and physician's assistants to streamline the administering of vaccines. I want to close with a few points on current eligibility and the criteria for the A1 plus population. There has been a lot of public conversation about educators and school staff and those with developmental disabilities being made eligible for the vaccine, beyond those current seniors and otherwise eligible. I can assure everyone watching today that I hear these concerns, and I share your hope that we can vaccinate these deserving Georgians soon. The truth is, we do not yet have enough vaccine for those most at-risk serious complications or death from this virus. With nearly 530,000 Georgians vaccinated, we have not yet reached the halfway mark to the current A1 plus population, which, as I said last week, numbers over 2 million people. With limited supply and no indication when we will begin receiving an increased weekly allotment in the coming days, Dr. Toomey and I are committed to vaccinating as many of the current A1 plus population as quickly as we can. Once Dr. Toomey and her team feel comfortable that we can expand that criteria, we will be ready, and we will move quickly to do that. Our public health and frontline health care workers in every public health district, hospital, and doctor's offices across Georgia are working literally around the clock to administer the vaccine, answer phone calls, and schedule appointments. I just want to say how grateful I am for their service to our state. I'm asking Georgians to remain patient with them as we continue this effort, and also just to thank them, quite honestly, for how hard they've been working, long hours for many months now, and certainly those in our hospitals over the last several weeks as we've experienced the post-holiday surge. With that, I'll turn it over to Dr. Toomey, and then we'll come back up and be glad to answer any questions that you may have.
Thank you, Governor, and good to see you all today. I want to say just a few things about the numbers that Governor Kemp outlined, because I think it's important to note that cases are going down, but we are still seeing considerable spread throughout Georgia, and how important it is for us to continue to follow just the basic prevention messages. It's just since the pandemic began, we have documented 4,500 total COVID-19 outbreaks. And to put that into some perspective, that means about 127 outbreaks per week for the last 12 weeks. And in past years, we normally documented about 127 total outbreaks for all diseases statewide. So I think that shows you and demonstrates the magnitude of what this has been, not just for the public and for policymakers to deal with, but also for the public health response team, because this has been an extraordinarily heavy lift. We still see nursing homes being the top site for our outbreaks, and I think again reiterates why we chose the older adults in and out of long-term care facilities as our top priority for vaccination, as well as healthcare workers who care for them in long-term care facilities and hospitals. Talking about vaccinations and moving on to where we are, because I know there's a lot of questions that you must have. We have, as of this morning, the very latest data I got just a few minutes ago, administered 713,923 doses. And that's 268,000 doses in the last 7 days. That's a great increase over what we've been doing before, and represents about almost 60% of the use of our total allocation. But I want to remind everyone that our allocation really is not very large for a state of our size, with a population of 11 million, and our allocation is based on total population, but there's very little vaccine. I was on a call with CDC and the new administration over the weekend, and was told that it may be as late as April before the vaccine will be ramped up to the point that we'll get more doses. We're hoping it will be sooner. We certainly will use it as soon as it's ready. We may have a new vaccine available through Johnson & Johnson even before that. But what we have done is prepared for this. The executive orders allows a much broader range of providers to be able to give vaccines in many different locations, and including school nurses. In my discussions with the school superintendents, I emphasize that school nurses will be able to deliver vaccine both to staff and others eligible in the schools. And so we are ready. We can do all these things ahead of time so there won't be any bureaucratic hurdles when we open up to that broader category of individuals. I know we continue to get questions about who we're vaccinating. We're trying to focus on in-state individuals and those out of state who may be working here, who may have homes here for the winter or the summer. We are working on mass vaccination sites. Again, all this is dependent on the availability of vaccines. And I also wanted to point out, because I know this is confusing, that CDC has changed their guidance. The second dose can be given a little earlier, a few days earlier, up to 4 days earlier than the 3 or 4 weeks, depending on which vaccine, the Moderna or Pfizer vaccine you got, or as late as 6 weeks after that initial dose. Now that's a big change because I think a lot of individuals, particularly those very anxious to get their second dose, were very concerned because they weren't able to schedule right away on exactly 3 weeks after their shot, or exactly 4 weeks after their shot. I've tried to reassure them, as I have talked to many people myself personally over the weekend, that there is that guidance now that kind of loosens that necessity to ensure just an exact date, but rather you can safely delay a few days and even as long as 6 weeks. All of our health departments now are scheduling second dose when you get your first dose, so there won't be this concern about trying to ensure that the second doses are available. And so I do want to reassure the public, we've heard you. I know there's been a lot of frustration in trying to ensure that individuals get in for their second dose, and all the health departments have told me that they have posted how to get their second dose, or actually reaching out themselves to call people or email them to let them know about the availability and to get them scheduled. So I kind of hit on some of the things that I know are some of the hot items that I'm hearing about and are hearing about over the weekend. But I did want to also point out that we have not seen any major complication from the vaccine. I know there's a lot of rumors going around that there may have been individuals who died from the vaccine. I heard there were 20 or more, and that's absolutely not the case. There is no evidence that Hank Aaron passed away because of the COVID shot. I know people are saying that. I've seen it on social media. I think it's just important that we quell these kind of rumors, because we don't want people to be dissuaded from getting the vaccine when they get called, and they may get called by their providers. I know that many of the hospitals throughout the state are reaching out to their clientele and letting them know the vaccine's available, come in. And I think there is some hesitancy still that we're trying to overcome. And it's that kind of rumor that may dissuade some of the most vulnerable people from getting vaccinated. So with that, I'll leave it to you for questions, and thank you for being here today.
Hi, Governor. I have 2 questions. First of all, you said that 99.5% of the state's long-term care, senior care facilities have been visited by vaccine teams. What percent of those patients, and separately, what percent of those workers?
I'm sorry, I can't hear you.
What percent of workers at those long-term care facilities have, what percent of uptake do you have? What percent have accepted the vaccine? I don't have a number on that. Perhaps Dr. Toomey does. Early on, the number of folks working in these long-term care facilities, we had 70% of those individuals that were not taking the vaccine. Is that fair to say? That's still being consistent? We saw numbers as high as 50% or so in hospitals of the folks working there that did not take the vaccine. I think they should get it.
but that was one reason that we expanded the criteria to go to 1A+ for 65 and older, well before the CDC recommended that, because Operation Warp Speed, I think to their credit, sent the number of doses to these facilities thinking that that percentage would be higher when it was not. It created that situation that we talked about, a couple of weeks ago, where we had oversupply in certain parts of the state, still didn't have enough supply for healthcare workers, long-term care facilities in metropolitan areas of the state, which is why we expanded the criteria so we did not have vaccines sitting in freezers. But that's the number that we're still dealing with. But that being said, we've moved on from that. Those folks are still eligible. I would encourage them to get the vaccine. As Dr. Toomey said, it is safe, it is reliable, it is effective. They should get it. But if they're not going to take it, we're going to move that allotment that was going to CVS and Walgreens, put it in the general population to continue moving the needle on the 1A+ criteria population.
And to what you just said, a follow-up for either you or Dr. Toomey, during that period when you had a lack of uptake and maybe even continuing, has any vaccine been lost to spoilage in Georgia that arrived here usable?
I'm not aware of that. I know we had some that was shipped somewhere. I'm not sure if it was coming here or somewhere else that had that situation where you had spoilage. That was immediately replaced from what I understand. Do you have anything, Dr. Toomey? Okay. Yeah, we're not seeing any issues with the transportation logistics of the vaccine, especially Moderna, or I guess with the Pfizer, for the severe temperatures that you have to keep these vaccines. Okay.
Hello. Is the state trying to stop this so-called vaccine tourism where people are coming over to get COVID shots? I know you addressed it before, but the couple who came last week says they will be back for a second shot. So what are the requirements, and is the state doing anything to try to stop that?
Well, I may let Dr. Toomey speak to that. I know she mentioned that last week. I don't have that on my radar as a significant problem here. I know that there's been some articles written about that in regards to Florida and other states. But look, my priority and Dr. Toomey's is to vaccinate Georgians, and that is what we are working on. I don't know if you want to add.
I think it's important that everybody know we're not going to be checking driver's licenses or, we're not going to police this process. Does that mean that somebody may slip in from out of state? Possibly, but I think it's so irresponsible and selfish for them to do what they did from Alabama. I would think that people would hesitate to do that. And we have a great need here. But we do have individuals who legitimately work here, but live in Tennessee, live in South Carolina, live in Alabama, and they could be vaccinated here either through a clinic or through their work site. And that's a very legitimate thing, even as our own citizens may be going into other states to work and get vaccinated as well. And I think that that's important, that we don't want to be policemen. We want to encourage and as much vaccination as we can. But we have reinforced with the providers that our top priority is always going to be our own residents here in Georgia, starting with that highest risk population. But even in referring to your a prior question, if you open up a box of Moderna, the 10 doses, and somebody doesn't show up, or someone decides, hey, I'm going to wait on that vaccine, we're not going to waste that vaccine. And we may end up giving that vaccine to somebody out of turn, but we're not going to waste that vaccine. And I think that was the question being asked. I just want to reassure you, we recognize how precious this is. We may end up doing a staff person who isn't over 65, but to use that vaccine rather than let it go to waste if there's some hesitancy.
Governor, can you talk about working with the Biden administration now, the transition? How has it been, better, worse, different, and how cooperative they have been in trying to get the doses here?
Well, I know I haven't had any communication with them. I know my staff has with folks that are in their kind of government affairs office. Dr. Toomey mentioned talking to her counterparts that we'll be working with. I know there's been a lot of discussions in the plans about potential operations that FEMA and other folks may do, and obviously General Cardin has been communicating with the Joint Chiefs and the National Guard Bureau on the deployment of hard-working Georgia soldiers that went to Washington, D.C. So we'll continue to do that. I'm currently trying to give them a little bit of leeway to get their feet on the ground. From everything we've learned, we know nothing's going to change much with our supply here over the next couple of weeks. So we're going to continue to push very hard to get every vaccine we got out and continue working on second doses, and then we'll get further communication on that. But our team has been in communication with them just like we were with the Trump administration, and I think that will continue. Certainly we want to work with them. Once we get details on the plans, I'll better have an idea of whether I think they're good plans or bad plans. But until we know, we're going to keep moving forward. Like at some point, whenever it is that they tell us that we get more supply, we are going to be ready to deal with it from the state perspective. If there's some sort of federal plan out there that would circumvent that, or something that they want to do different from what the states are doing, I'm sure we'll have opportunities to communicate with them. But my goal is to make sure that we are ready when that day comes and not rely on the federal government for that. We've certainly gotten a lot of resources in the Trump administration. I know they're working on that as well in the Biden administration, so we'll continue to work with them on those efforts, to work with our congressional delegation and continue to move the needle on getting vaccines done so we can return to normal here in our great state.
Good morning.
Good morning.
Folks in Georgia still can't look at a state website and see in what counties vaccines are being delivered and what the demographics are of the folks getting the vaccines. I know the state has talked about upgrading its information technology. Is there any urgency to getting that fixed sooner rather than later? Well,
there's definitely urgency in everything that we're doing, including, scheduling, website communications, but also would urge people caution that just to move off of a platform, even though it may be antiquated, is currently working, to something that we're not positive about, and doing that prematurely could be disastrous. And we're just not going to do that. We have a lot of good people that are looking at that right now. As I mentioned in my remarks, Dr. Toomey and our team are literally working 24/7 for how we can ramp up further. We can't really ramp up too much further right now from where we are because we don't have an additional supply of the vaccine. But we are planning for that day like it's going to be 2 weeks from now. We know it's probably not going to be in 2 weeks. It's going to be much further out than that, but we just don't know when that date is. So we're going to continue to do everything possible to make it easy for Georgians to be able to schedule an appointment and get to that appointment. But listen, I'm going to be honest with people. We know that there's been issues. I mean, we've had county websites or county public health sites that have gone down. We've had call centers that have been inundated at the county level, and we tried to be very transparent and let people know we felt like these issues would come, just like it did with testing and other things. And we're going to continue to learn from those, fix them, move on, and make it better. But a good example is Publix opened up availability this morning based on what they're getting here in a few days, and those appointments for one whole week sold out in 45 minutes. I mean, it was more demand than you would see for a Georgia-Alabama SEC championship football game. And that is what we're dealing with, and we're going to keep dealing with that, because I don't believe until Johnson & Johnson comes on board and we get many months out that we're ever going to get to a point where we have more supply than we have demand. Our job is to make sure that we're continuing to make progress, but also letting the public know where we are. And that's why we've been doing these press conferences, and we'll continue to do that.
This is a question for the governor and for Commissioner Toomey. A House subcommittee this morning proposed a number of $1 million to replace or modernize the grid system, as well as to hire some new top managers for the Department of Public Health. Can you talk about how you might use that money?
Yeah, I haven't heard that. I don't know if Dr. Toomey wants to speak to that or not. I'll say this, that we have had unprecedented cooperation with the legislature since the elongated session ended in June. We've had great discussions with Chairman England, Chairman Tillery, with the Speaker, Lieutenant Governor, leadership in the House and Senate about what our budget looks like, about how we move forward. But this is all part of the process. Every year the legislature, per their constitutional duty, has their input that they want to make on the budget. We stand ready as the executive branch to work with them to make sure if they are appropriating money for things like that it makes good sense to do that it's something that we're capable of doing, and that also that the timing is right. I think a lot of people want us to do a lot of things right now. We've got to make sure that we stay focused on the #1 mission that we have. And for me, and I don't want to speak for Dr. Toomey, but for me, that is making sure that we're getting people vaccinated, that we have enough hospital beds in our state for anyone who needs one, regardless of whether it's COVID or not, and that we continue to stop the spread of this virus so we can get back to a full, open, normal economy and quality of life here in the state of Georgia. Do you want to add anything to that, Dr. Toomey? Okay.
Hi, and a question for either Governor Kemp or Professor Toomey. So as you are doling out, we get an allocation, you all decide who gets how much vaccine out of the requisitions that either the health department or the institution has put in. How are you deciding who gets how much? What criteria are you using?
Yeah, it's a good question. We're actually working on the allocation of the vaccine right now. Obviously, early on, no fault of our own, when we had a lot of doses going to parts of the state where the demand for unknown reasons, quite honestly, wasn't what some in the federal administration thought at the time. And I sincerely believe they were making a really good decision there. It just turned out 70% of the people in these long-term care facilities and skilled nursing facilities were not taking the vaccine. I believe we're over that hump now. The vaccine is going where it needs to go. I have lots of people that are saying we can do more if we have the doses. These are county governments, health departments, other providers like our private sector folks, our local pharmacies, large chain pharmacies, and other folks. But part of our challenge, I think, ahead, or probably a better word, is our mission ahead is going to be when that day comes and we get that increased supply, how do we make sure we're getting it to the places that will get it distributed the fastest and the safest way possible? And that's what the team's working on right now. Dr. Toomey mentioned mass vaccination sites, perhaps more doses to the partnerships that are out there, either through our medical facilities like a hospital, large chains of doctors' offices and networks that are out there, local pharmacists, county governments that are working with their local health department, like I know has happened in places like Cherokee County, up in the city of Dalton. Fulton County was communicating with us recently that they're ready to go. So there's a lot of people that are really working hard together that are doing great work out there. They could do more if they had more vaccine. But we've also got to focus on some of these counties that maybe don't have the bandwidth and figure out how do we help them move the needle if their county government doesn't have the resources or the willingness to work with them. And that's what we're working on as well. I've said many times we will use every available state resource that we have to get this vaccine out and to help those that are on the ground in public health and other places be able to administer that, including the private sector. But the fact remains, right now we do not have the supply of the vaccine to do that, but we're planning for that day when it gets here.
Governor, a representative in the House was removed from the floor today for refusing to be tested like all lawmakers are supposed to do. Do you have any reaction to that? Do you think that sends a negative message for him to not be tested?
like everybody's, or do you think that Georgia's leaders should have some autonomy in whether they want to do things?
I don't really know a whole lot about that. I know that Speaker Ralston and the House leadership has worked with their members and worked with Dr. Toomey's team to set up protocols for how we could keep this building safe during this session, so we didn't have to go into a suspension, so we could get the people's work done, which is very important, especially with some of the issues that we're dealing with the budget and other things. I know that Lieutenant Governor, President Pro Tem Miller, Leader Dugan, and others have worked with Dr. Toomey on the protocols in the Senate. That is how this building works. They're the legislative branch. They govern their policies and how they run their business on the floor. I will tell you that the executive branch, in coordination with Dr. Toomey, we have a testing program for our office. We're testing every Monday. The First Lady and I both took our test Monday morning when we got here. Obviously, we got good results from that. So we're making sure that we're following the protocols. I think it's incumbent on everyone in the building, whether you're a legislator, whether you're working in the executive branch, member of the media, the general public, we all need to follow the guidance and best practices to keep you safe, but also to keep others safe from you if you happen to be infected and you're asymptomatic and for some reason that hasn't been caught. But that's really about all I would have to say in regards to that. Thank you all for being here.